Hello, and welcome to the Thyroid Warrior podcast. I'm Ebony, and I'm here as your wellness facilitator. I'm going to be sharing my experiences in managing Hashimoto's disease. I really hope that it'll help you on your personal journey. Keep in mind, however, this does not substitute for medical advice. It is only for your information and motivational purposes only. Now, let's get started. Hey everyone, today I want to talk to you about why mental health is so important. What does it have to do with your thyroid condition and how it's really important to practice self-care? One of the biggest things that is really important to me is mental health. I feel as though everyone deserves to have a peace of mind, and it's really important for you to take the time out to recharge and do something that makes you happy. Particularly when it comes to making sure that you're doing what you have to do to take care of your body. For example, I want you to think about a pendulum and how it swings back and forth. For a long time, I felt like I was on an emotional roller coaster because I had both hyper and hypo symptoms. I felt all over the place. I would be really depressed, followed by a high, and then I wouldn't sleep, and then I would want to sleep for 5 days. I had anxiety, and I had brain fog, just to name a couple of things. So I went to see a psychiatrist, and he prescribed me medication. I said, okay, well, you're anxious, you're all over the place, you might be depressed, you might have some anxiety. Let's put you on a combo medication to see if that will resolve the issue. Naturally, the medication did nothing. So after a couple of visits, I went to him and said, listen, I'm not taking this. It doesn't help. You're wasting your time writing this prescription for me, and I'm just leaving the prescription at the pharmacy. So let's just save both of us some time. And was really sad about that situation is that he was a nice person, but he wasn't a good fit for me because he was traditionally used to treating his patients with medication. And for me, what I personally need is to talk out my feelings and have goals and different things that I need in order to sort through the issues at hand. And that's okay. What I had to learn was that sometimes you have to try out a couple of folks before you really find someone that you gel with. And it's very important that you add mental health to your patient care regimen, so to speak, for yourself. In my case, I would go see my endocrinologist, and obviously I didn't want to talk about all of the emotional things that I was going through as a result of having my thyroid disease, but I knew that I needed to get it out. So I found a therapist, and she was amazing. And part of the healing process is really becoming your best self through processing the feelings and being able to deal with them in a manageable way. A lot of times you forget about the trauma that may have occurred in your life, whether it was trauma in the traditional sense of something really serious happening to you, or it could be maybe you had an abusive parent, or maybe you had a parent that wasn't there. Even though you may not have gone through the same thing that is considered quote unquote traumatic as someone else, it's still your struggle. It's still your story. Now, for me, I have been in therapy off and on since I was about 7 years old. As an adult, I could truly process my feelings, and what was really important to me was I didn't want those things that happened to me as a child to manifest themselves in my adult life. And knowing how my immune system is set up, I wasn't willing to put myself in a position where I would have to manage all of those additional emotions, particularly when a holiday came around or a birthday came around. I just didn't want to do that. And that is part of the reason why I chose to go to therapy. And what was really great about that was I was able to shift my focus. My joint pain wasn't as bad as it was before. I could actually sleep. My anxiety lessened. And I truly felt as though, okay, I can do this. This isn't as bad as I thought it was going to be. So my top tips would be look up a therapist in your area. Figure out if you have insurance, if they cover it. Even if you don't have insurance, there are some offices that accept a sliding scale when it comes to payment. You can go to your local college or university where you have students that are fresh out of school that have just been licensed and they haven't quite built up a clientele yet. And oftentimes you'll be able to obtain services from that person for a lower fee. You can figure out what resources you have at your job. A lot of times they have some type of employee assistance program and you can go and talk to someone. And you can also talk to your doctor about it, meaning your primary care physician or even your endocrinologist if you have that relationship with them. Nothing is wrong even with talking about it with some of your friends that you know that may have gone to therapy. Ask them what their experience was. Ask them how they felt after coming. Keep in mind, some of them might say, that was really intense. That was a lot. I wasn't ready. But understand that everyone is at a different path. And the reaction that you might get from person one could be very different from person two because they're in different stages of their journey. So just keep that in mind as well. I know for a lot of folks, it's very intimidating to admit that you need to talk to someone. But what I can assure you is that you're not alone. There are plenty of people that seek out therapy. And it's very important, especially if you have a lot of responsibility, whether it's at home, whether it's at work. If you're a caretaker, you have a tremendous amount of pressure and stress and a lot of things that other people don't have to deal with. So that's another thing to consider. And if, for example, you're just learning about your diagnosis, you're probably experiencing a lot of things and you need that support to help you get through the first couple of months to a year until you're really settled with your medication and treatment options. So it's really, really important that you really think about it. Again, I understand it's very difficult for some folks to even go down this route. However, it's an option for you. It's a treatment option that very well can help you feel a lot better and can also minimize your symptoms because, as I've said before, when you are happy and from a mental health perspective, when you have things in order up there, naturally your antibodies will go down. Naturally, you'll feel better. Naturally, you'll begin to notice that a lot of your symptoms subside. So just think about it. The other alternative that I think is really important is practicing self-care. I cannot stress this enough. You cannot be someone else's something if you're nothing for yourself. I have learned this the hard way. I experience this on a regular basis. I am constantly struggling to make sure that I take care of myself because I know that my condition is triggered by stress. And when I put that extra pressure on myself, naturally I get stressed out and then I feel terrible. My joints start to hurt. My head hurts. I can't think. And nobody really needs that because if I'm going to put my best foot forward, I've already taken 2 steps backwards because I chose not to take care of myself. So what do I mean by practicing self-care? You can read. a book that you like or a magazine, or you can listen to an audio book. You can journal and write out how you feel. Take it one day at a time. Whether you take a Saturday or Sunday and you say, you know what, today is my day. I'm going to do whatever I want. If that means I'm going to go to the park and sit and just people watch, or if I'm going to go to the mall and walk around, or if I want to purchase something nice for myself, that's perfectly okay. The other thing that you want to think about when it comes to practicing self-care is learning how to say no. Repeat after me. No. And you're probably like, why is she saying that? But when I tell you, I used to be a yes man. And I would say yes to 50 million things. And next thing I know, I'm like, oh my God, I just agreed to do 15 things for 20 different people. I have no idea how I'm going to get it done. And I end up staying up too late for maybe a week or more. And once I get everything done, I'm out of commission the next week because I've tried to do all of this stuff for other people when I neglected my feelings. I didn't exercise. I didn't eat the way that I was supposed to. And now I'm stuck in bed because my body hurts. So think about it. Even if it means you have to go in the mirror and ask yourself a question and politely say no. And sometimes you can say no, but the other person doesn't need to realize that you're saying no. If someone asks you something, you can say yes, but remember, I said I was going to help you with A, B, and C, but if I do this additional thing that you've asked me to do, I won't be able to deliver on A, B, and C. Is that something that's a priority for you that you need right away? If it is, then I need to focus my energy on getting you a quality A, B, and C. The other thing is be easy on yourself. I know that I have always put a lot of pressure on myself to get things done. I am very much so the type A person where I want to make sure I've dotted every I and crossed every T, and I put a heart on some of my I's because I just want to have that extra personality and flair. Now, I like to think of myself as a recovering perfectionist, and I have been learning this very valuable lesson. Be nice to yourself. Again, you can't be someone else's something if you're nothing to yourself. Slow down. The best way, in my opinion, of being Superwoman is to prioritize what matters and take care of those things first. Saving the world is not at the top of that list. So if you're a mom, yes, I understand your family is first. Your babies are very important. But if you're taking care of your babies, you're taking care of your significant other. And if you're not practicing that self-care and you get sick, everyone's going to look at you and say, wait a minute, mom's sick? I don't understand. What do we do? And I have asked this of my mom and of a lot of people that I really look up to and a lot of my mentors, like when they tell me like, I'm sick. No, you're not. You're not sick. What do you mean you're sick? What am I supposed to do? How am I supposed to handle this? What am I supposed to say? So again, that's just a really funny example to me, but I fall victim to that, particularly when I go and I talk to my mom and, she tells me she's sick and I'm like, I don't understand. It doesn't dawn on you that your mom, for example, is human and she might need to rest sometimes. So if you're not a mom, maybe you're a girlfriend or maybe you're a really good friend or you're that go-to person for everyone, just remember, take care of yourself and be easy on yourself and slow down. You have to take things one step at a time so that you can be your best self to give to other people and be able to do all of those things that you enjoy doing. Now, what do I want you guys to do today? I want you to journal about your feelings. Talk to someone. You're not alone. If you want to just call up your girlfriend or, your aunt or uncle or someone that you're really close to, say, hey, you know what? I just wanted to call you today and say I love you and thanks for always making me feel great. I can always come and talk to you and you're always there to listen. I just want you to know that that makes me very happy. And watch how much better you feel when you talk to that person. Okay, thyroid warriors, get out there and take things one step at a time. Remember, be great, reflect on your triumphs, and as always, be well. Take care.